So I think the therapies in the past, it was helping people to cope with tinnitus. It was only, for me, it was a psychological approach. Yeah. That's all. And now, so we start to have a model. It's a simplistic model, but so it's this decrease in sensory inputs that will induce some central changes. So we can now, if indeed this is a decrease in sensory input that will cause tinnitus, so we have to compensate for this decrease in inputs. So from the animal research, from scientific model about the mechanism, so we can deduce a therapeutical approach. So assuming that our model is okay to account for the emergence of tinnitus, so the model is saying that a decrease in sensory inputs again, so we'll increase some kind of control gain in the centers. So we have to compensate for this decrease in sensory input. So we stimulate specifically in the frequency band of hearing loss. We stimulate specifically where the subjects do not hear anymore, or they are still hearing in the frequency band of hearing loss, but there is a decrease in the sensitivity. So we try to compensate for this decrease in sensitivity. And there are several possibilities for compensating this decrease in sensitivity. First, it's the hearing aid. So the role of hearing aid is to compensate for the sensory inputs, actually, by amplifying the sounds in the environment. So the cochlear implant in case of deafness, and so there is also the extracochlear stimulation, and so we are working on it also, extracochlear stimulation, electric stimulation, and there is the acoustic stimulation, simply, so, and stimulating, so in the frequency band of hearing loss. And so we got, I think, encouraging results on hyperacusis. So hyperacusis, it's an overestimation of the loudness, and it's often associated with tinnitus. And we got a decrease in the sensitivity for loudness in these hyperacusic subjects after it was 15 weeks of stimulation. I think it's a clear result. It's encouraging, and so for instance. So in average, for the hyperacusic subjects in our study, the loudness discomfort level was in average 70 dB SPL, which is very low actually for a loudness discomfort level. And so we obtained a gain of 20 dB in average. So 20 dB more, so it's a lot. So the difference between 70 dB and 90 dB, it's totally different. And a lot of patients were very, very satisfied about this increase in the dynamic range of hearing.